Okay, this is Vet 2005, and we talk about clinical practices in this class. Um, we're going to talk about veterinary terms, a little bit some jargon that you're going to come across associated with common surgical procedures. Now, these surgical procedures are things that we have covered previously. Sometimes we cover it just a few weeks ago, sometimes it's a month or more ago, but it's really important that you understand these terms. An abdominal procedure is when we open the abdominal cavity, and there are two ways that we talk about it. The celiotomy is a surgical incision into the abdominal cavity, and a laparotomy is when we would do a flank incision into the abdominal cavity. So a flank incision would be on the side of the animal. A surgical incision with a celiotomy is more down the center line of the animal, which is more common with small animals, and you'll see that more frequently. If we're going to be doing an abdominal exploratory surgery, that's just when we make a larger than a spay incision, open up the abdominal cavity and explore it to make sure that we're seeing anything that may be going on. This is a common incision for a celiotomy. This is a male dog. We can see the penis here. Often we will actually take some towel clamps and clamp this sheath off to the side. So if he should have to go to the bathroom at all, we're not going to get a urine stream into the celiotomy incision. But our incision will go around the sheath of the penis, not straight down through it. A gastric foreign body is pretty common, and especially in some of our um, dogs. It's anything that is an ingested foreign object, something that is not food, and it becomes lodged in the stomach. Or some again, the gastric foreign body would be in the stomach, and the animal's not able to digest it. The primary reason to perform a gastrotomy, which otomy means a hole in or an incision into the stomach, and the primary reason is to remove a foreign body. This can also be referred to as a gastric obstruction, and there's a distinction made between gastric foreign bodies, which are found in the stomach, and intestinal foreign bodies, which are found anywhere in the intestines, which are the duodenum, the jejunum, the ileum, or the large intestine. We have some pictures here of some really common foreign bodies that we'll find. Um, Rawhides, unfortunately, are very common. They're a treat that many people, they're a cheap treat. Many people can afford to give them to their dogs. Dogs love them. Unfortunately, are difficult to digest. The dog can choke on them. The dog can have them as a gastric or intestinal foreign body. Underwear, typically not new underwear, but underwear that's been used is a common foreign body as well. And then tennis balls. Some clinical signs of a gastric foreign body. So, how do you know that your dog may have eaten something that they weren't supposed to? Um, Now, typically we do see it in puppies, so that's much more common to see it in younger dogs. Vomiting, lethargy, abdominal pain, not wanting to eat, which is anorexia, and depression. The problem is that those are pretty vague signs, and those can be signs of a lot of different diseases. So we have to start looking at some diagnostics to help us to understand if there's actually something stuck in the stomach. Some clinical signs can be worse if the foreign body has gone through or perforated the stomach and caused peritonitis, which is inflammation of the peritoneum. So if we have gastric contents like acid or bile or something that was in the stomach in the inside of the abdomen, outside of the intestines, inside the abdomen, that's going to really do some damage there, and they're going to be very sick. Um, so if it's an intestinal foreign body, we call an incision into the intestines an enterotomy. So enteritis is the inflammation of the intestines. Enterotomy is an incision into the intestines to remove typically a foreign body. Intestinal foreign bodies can cause a partial or complete obstruction of the intestinal bowel. So socks, used washcloths, these are also pretty common. They'll make it through the stomach, but then in a smaller part of the intestine, they'll get stuck. Uh, Intestinal resection and anastomosis. So resection means to remove, anastomosis is to put back together. And you can call it a R&A. It's an excision of the segment of bowel followed by the reestablishment of the two remaining segments. So primary indication of performing an intestinal resection and anastomosis is to remove a section of dead or diseased bowel. Causes of devitalized or bowel, which means it's not living anymore, include foreign bodies, neoplasia or cancers, masses, intussusception, which is where part of the intestine move into the other part of the intestine, kind of gets kind of balled up like a sock, necrosis, so dead tissue, and ischemia, which is lack of blood flow to the area. This is a picture kind of diagram of what is happening. So within the intestine, on this side, this is the mesentery. This mesentery is tissue that blood vessels travel up through a main artery and vein and travel up to the different parts of the intestine. So it's really important that we have a mesentery that has lots of blood vessels flowing to the intestine. That's how things are digested, and it's how we keep the intestines alive and moving. Well, if we have an area here that is dead or has a mass in it, or we just need to remove it, we need to clamp off, hold off the section of the intestine. Now, these are fingers, and these are typically your fingers. So if you are scrubbed and gloved in, you may actually be holding this for a fair amount of time, just enough, not enough that you're clamping the tissue, but enough that you are stopping the flow of intestinal contents through that section of intestine, because we don't want it coming out into the abdomen and causing peritonitis. Then these two spots are going to be brought together, and they're going to be brought together, and we're going to sew up the mesentery through the vessels and into the intestine. Now, I will point out that there's a stay suture here that goes all the way through the intestine to the other side, and that's going to be brought together. And then we're going to want to remove those stitches, because if we have a stitch that goes, or a suture that goes in from the inside of the intestine to the outside of the intestine, there are other things that will travel from the inside of the intestine to the outside of the intestine. Once removed, there's the body heals itself very quickly. You won't have a hole there. It's a very small hole, and it'll heal very quickly. But when we are placing sutures, we're very careful not to go full thickness. We're just going to go on the outside portion of that intestinal wall. Let's see. So the next gastro or enterotomy type of surgery that we might come across is a gastric dilatation volvulus, or GDV. This is when we have swelling or distension, usually it's caused by gas, and then rotation of the stomach on its mesenteric axis. When we're talking about mesentery, we're talking about this section here that is tissue that holds that part of the intestine or part of the stomach in place in the abdomen. And if we have a twist, it's going to shut off those vessels. And so we have to be very careful that doesn't happen. So the dilatation is a stretching of the organ beyond its normal dimensions. So if you've ever had a really large meal and get a little uncomfortable afterwards, that's dilatation of your stomach. Okay. If it gets even fuller with gas, it's going to cause a lot of pain and discomfort. Volvulus is where we have the rotation of that organ. A small animal patient can have a gastric dilatation or bloat without the volvulus. So that would be called a simple gastric dilatation, or we call it bloat. Okay, but the problem is bloat really doesn't distinguish between simple gastric dilatation and gastric dilatation with a volvulus, because you can bloat with a twist as well. So here's a picture representation of what it looks like. This is how the stomach is supposed to look. We have the stomach here, the spleen is down here, and there are a lot of vessels that run between that. Or I'm sorry, this is how it's supposed to look. And this is how when it twists 90 degrees, if it then twists 180 degrees and then twists 270 degrees and then a full 360 degrees, the spleen is in the wrong spot. You're twisting off the vessels to the stomach and the spleen, and you're devitalizing all of that tissue. So this is how it twists. It twists in this direction. When we look at it with an X-ray, we have what we call a double bubble. So here's you can see this is all stomach. This is the part of the stomach that has food. This is the part of the stomach that has gas in it. And it is twisted, and you can see a line here that shows this twist here. You don't see it here at 180, but you can see it at 270 and at 360. This probably is a 270, and that is cutting off the blood vessels. Okay. So there are a couple things we can do. We can use a gastropexy to keep this from happening. It doesn't keep them from having a bloat, but it is something we can do preventively when they have their spay or castration. Or we might do it if we have an animal with a GDV. Once we decompress and twist it back and make sure everything looks okay, we can actually tack. We'll take a little slice out of the stomach, the outer portion of the wall of the stomach, a little slice out of the portion of the wall of the abdomen, and we'll suture those two things together. Now, the reason we take slices out is because that gives us fresh blood vessels that will heal together. And that creates a really strong scar tissue adhesion that will keep that in place. It is something that I absolutely recommend for any large breed, deep chested dogs. Standard poodles, both of my poodles had this done. Um, Great Danes, Mastiffs, anything that has a really deep chest, absolutely recommend doing this as a preventive measure. So that's a permanent gastropexy. Okay, another one. This is a really common, you're going to see this every single day in your practice. It's an ovariohysterectomy or a spay. Some people call it a neuter, but we really tend to refer to neutering animals to male animals, removing um, the testicles, whereas a spay we tend to refer as a female animal ovariohysterectomy. Anyway, it's the surgical excision of the ovaries and the uterus. We also, in shorthand, refer to this as OHE. So if you don't want to write down ovariohysterectomy, but you write down OHE, we will know what you're talking about. So we want to sterilize the primary reason is to sterilize the animal so that it can't reproduce. Secondarily, we might want to do it to reduce the chances of pyometra and mammary cancers. So pyometra is a pus-filled uterus. We see it more often in dogs than cats, but we do see it in both species. Condition can be either open or closed. It depends on the cervix. If the cervix is open, we call it open. And if the cervix is open, then things can come out. So you'll start to see a purulent or pussy discharge coming from the uterus. Both of these are serious and need to be taken care of. Now, this is a smaller pyometra, but this does have pus in here. This is a larger pyometra, so this is a pus-filled uterus. Can you imagine? That's just one big abscess in there, and you can see this on X-ray here as well. So this big thing of tissue, the colon is up here. This big fluid-filled or mass within the abdomen is a pus-filled uterus. Now, you need to think back and think about when we talked about reproduction, when are pyometras most often seen within dogs or cats? And the answer is when they go through diestrus. So diestrus comes after estrus, or it's also can be called medestrus. Um, Estrus is when the cervix is open and they may or may not have intercourse. It's when the cervix is open when bacteria and other things can get into the uterus and cause infection. And then the cervix closes down and it keeps the infection in there. So diestrus is the time of estrus when pyometra typically occurs. And that's why we ask, when was your dog last in heat? Because we need to know that. Castration. This is also known as neutering, altering, or an orchiectomy. Orchi meaning the gonads. The primary indication is for sterilization, but we may have to do it for removal of testes due to cancers as well, or for prostatitis or prostate cancer. So here is an example. The penis is here. There's an incision below the penis, and the testis is being pulled up. Um, this is an open castration, meaning that this white portion, you can see a cut into it here, but that's the tunica albuginea, and that this connective tissue has been opened up to expose the cremaster muscle, the vas deferens, and the organ or the vessels that go up to the testy. And we've clamped these things off, and so we can tie them off and individually. Now we would do an open castration, what we call an open castration, for animals with larger vessels so that we can individually um, tie off those vessels. We would do a closed castration where we leave this tunica albuginea on and just do a really strong ligature over all of this when we have smaller vessels. This is a cat castration. So this is a smaller testicle. The rear end of the cat, the scrotum has been plucked or shaved, usually plucked, to remove the hair and then prepped. This is tying the vas deferens and the vessels off on itself. So we do a tie with a hemostat, pull it tight, and then cut off the testicle. A cystotomy refers to a surgical incision into the bladder to expose the lumen or interior of the urine bladder. Primary indication for performing a cystotomy is to remove what we call cystic calculi. Cystic calculi are bladder stones. Okay, here are some tiny ones. They can also be really, really big. We may also have to do a cystotomy if we have neoplasia or some congenital abnormalities, something about where the ureters come into the bladder, just to fix the confirmation of that. So this is an example of a bladder being held out of the abdomen. These are called stay sutures. That may be your job to hold this bladder up and out of the abdomen. Urine is typically and usually sterile, but it is a different pH, and so it can cause inflammation or peritonitis if the urine is allowed into the abdomen. The other thing is that usually when we're doing a cystotomy, the urine is not sterile. So it may be something that we need to just really double make sure that we don't have any urine get into the abdomen. Otherwise, we need to flush out the abdomen. So these are laboratory sponges that are put around, they're moistened and they're put around this very tender, friable, what we call friable tissue, because it's been holding on to stones and it's extremely irritated, and so we want to really protect it as much as possible. So moistened gauze pads surrounding it so we don't get urine into the abdomen. Someone is holding up this bladder so that we can make an incision and remove all the stones, and then we're going to suture that up. An onychectomy is declawing. Onychectomy. It's the removal of the claw and its associated third phalanx. It's usually an elective procedure to prevent the cat from scratching furniture of the owners. It is not something that we do all the time, but you will have clinics that do a fair amount of them. So we have to look at the anatomy of this toe and realize there are a lot of tendons that come down and allow that claw to be extended or pulled back into the sheath. So this is what we call the phalanxes. These are the bones of the digits. So this is the first phalanx, the second phalanx or middle phalanx, and the distal or third phalanx. And it's the third phalanx that we take off. So the very tip of your finger at the joint is what we would be doing. My recommendation would be to do it either this way or this way with a electrocautery or laser. So I would typically, with tiny kittens, would do it with a blade or electrocautery. And when we incise, we have to be really, really careful to follow along the bone, which is oddly shaped, kind of like the head of a parrot, because if we cut too close or too far away from the bone, um, this will leave some of the growth plate, and so that the nail will continue to grow and it'll grow oddly. Okay. If we cut too deeply through and we go through the pad, that's going to be more bleeding, more infection, and more pain for the kitten. So we have to be very, very careful as we cut through here to go right between the bones and then uh, turn it around and bring it up. So it's not easy to do an incision. Now, some of you may see doctors still using this device, which is a nail trimmer, to perform this. It is very, very difficult to follow this line using this nail trimmer. It can be done by moving this third phalanx out in a very specific way, but it is very unusual, and often we have to go in and take this portion of bone, which again is more trauma to the tissue. So we do not recommend the nail clipper onychectomy. If you have to do it right. Those are the common uh, veterinary terms during surgical procedures that you're going to see right away. If you have any questions, certainly let us know and we'll go over those questions in class.